Do you need clarification about choosing TAVR or surgery for aortic stenosis? This video is just the right spot to know. Transcatheter aortic valve replacement, TAVR, is a procedure where a new valve is placed in your heart through a small tube, typically in the leg. Whereas, in open heart surgery, a new valve is placed in your heart by opening your chest and replacing your old valve. Talking about the benefits of TAVR. It has a lower risk of stroke, major bleeding, and atrial fibrillation. Shorter hospital stay. Less pain. Rapid return to normal activities. However, TAVR results in higher rates of vascular complications, paravalvular regurgitation, and the need for pacemaker implantation. Ask your doctor regarding valve replacement options, lifespan, and available choices. Follow us for more videos to know about your health.